Hello, my name is Alice Simnicianu, and I work in WHO as an infection control specialist. One of my roles is capacity building in the WHO Health Emergencies Program. Today, I would like to talk you through Module 3, Organizing Vaccination Sessions, which has a special focus on infection prevention and control measures. At the end of this module, you should be able to outline the infection prevention and control measures during vaccination sessions to protect health workers, vaccine recipients, and the community. You should be able to describe how you prepare for vaccination sessions according to infection prevention and control protocols at the healthcare facility, and for outreach and for campaigns. And you should be able to outline the process of safe COVID-19 vaccine administration and waste disposal. Infection prevention and control is a scientific approach with practical solutions designed to prevent harm caused by infection to patients and health workers, and as we have seen in the context of COVID-19, it is also quite relevant in the community during a pandemic. It is grounded in infectious diseases, epidemiology, social science, and health system strengthening. IPC occupies a unique position in the field of patient safety and quality universal health coverage, since it is relevant to health workers and patients at every single healthcare encounter. Proper adherence to standard infection prevention and control practices can help to protect you as a health worker, your patients and clients, and ultimately your family and the community. There is now a WHO IPC aid-memoir document which provides a summary of the standard infection prevention and control measures which are required for COVID-19 vaccination sessions. These are the standard recommended infection control measures for delivery of vaccines. First, hand hygiene. We recommend either the use of alcohol-based hand rub or washing your hands with clean water and soap, as well as reminders of practicing respiratory hygiene and cough etiquette. Number 3 is the appropriate use of personal protective equipment, or PPE, which in this instance is the need to wear a medical mask for vaccinators. Number 4 refers to applying safe injection practices and safe disposal of waste, as well as maintaining environmental cleaning and disinfection, which entails maintaining a clean environment and paying special attention to high-touch surfaces. The use of standard precautions for every vaccine encounter is important because it is known that about 30% of those who are infected with SARS-CoV-2 do not have any symptoms. There are also links to relevant resources included in this slide. The first measure that you can do to protect yourself as a health worker is hand hygiene. It is considered the most important measure to avoid transmission of harmful germs and prevent healthcare-associated infections. If available in health settings, alcohol-based hand rub is preferable if the hands are not visibly soiled or dirty. We recommend rubbing the hands for 20 to 30 seconds or washing them for 40 to 60 seconds with water and soap. Vaccinators should always perform hand hygiene, preferably using an alcohol-based hand rub, given their logistical, their efficacy, and their tolerability advantages. They should do this before putting on and removing their personal protective equipment or their mask, before preparing the vaccine, and between each vaccine administration on a new person. However, if your hands are soiled or dirty, we do recommend water and soap and a single-use towel. There are many posters available on the WHO website which are linked here on how to perform hand hygiene properly. Just a note, gloves are not indicated for intramuscular injections unless there is skin breakdown. Applying alcohol-based hand rub on gloved hands is strongly discouraged and may actually cause damage to the glove, making them less protective. The type of PPE recommended is based on the health service provided, the individual risk assessment, and the additional transmission-based precautions needed. For delivering COVID-19 vaccines, the following PPE is recommended. Medical masks are recommended for the health worker. And for the person receiving the vaccine, they are to wear either a medical or a fabric mask. Keeping in mind, hand hygiene must be done before putting on or touching the mask, and people must avoid touching their mask when it is on their face. Masks and hand hygiene should be readily available for vaccinators and people coming in to get vaccinated. Masks should also be worn throughout the vaccination session, but should be discarded after use. As mentioned, the use and management of the mask is as important as wearing it correctly. The vaccinator should follow the IPC mask guidance and wear a medical mask when administering the COVID-19 vaccine. These are the steps when putting on or removing the mask. First, before putting on your mask, clean your hands with either alcohol-based hand rub or soap and water. Vaccinators should wear a medical mask when administering the COVID-19 vaccine and should wear it throughout the entire vaccination session. They should also avoid touching the mask while it is on the face. If you must do so, clean your hands before. Masks should also be changed when they become soiled, wet, or damaged. When you want to remove the mask, clean your hands and remove the mask by the straps, and pull the mask away from the face. Discard the mask in a closed bin and clean your hands again. Now let us talk about preparing for the immunization session. It is most important to inform the community and target groups in advance of the location and time for vaccination sessions. This is important that they know when to come and they come to the right place at the right time. It is important to set up safe vaccination sites and ensure adequate quantities of vaccines and supplies, adequate cold chain equipment, injection equipment, adequate PPE, safety boxes, and reporting tools are available. When setting up vaccination sites, it is important to set up the sessions in a clean and hygienic environment with adequate ventilation, which is needed to prevent transmission of COVID infection. If you are planning to do vaccination sessions indoors, it is important to ensure good ventilation by opening doors and windows. If vaccination sessions are planned outdoors, pick a well-ventilated area. Setting up vaccination sites to ensure physical distancing is important. It is important to ensure at least 1 meter distance in all directions between each person. Hand hygiene needs to be considered when setting up vaccination sites. We have evidence to prove that hand hygiene is the best way to prevent the spread of germs, both in healthcare settings and in the community. We know that our hands are our main tool for work as health workers, and they are the link in the chain of transmission of infection. Think about this when you are going to touch door handles, vaccination equipment, phones, patients, and the environment. Hand washing stations or alcohol-based hand rub should be readily available to ensure good hand hygiene for health workers and those coming for vaccination. It is important to screen for respiratory symptoms, including temperature monitoring for those getting vaccinated before they enter the vaccination area. Another point to consider is to limit the number of individuals entering the vaccination area to avoid crowding and long waiting times. If possible, vaccination and appointments should be set up so that there are a limited number of people in waiting rooms. Family members and the visitors should be encouraged to wait outside to prevent overcrowding. When setting up a vaccination site, a one-way flow of clients and staff should be maintained throughout the vaccination site, and directions should be posted for vaccine recipients to clearly follow the markings. Positioning the recipients either sideways or not having them sit face-to-face is one aspect of standard infection prevention and control precautions that should take place during safe administration of vaccines. It not only minimizes the risk of vaccinators coming into contact with respiratory droplets, but also ensures that the vaccinator is in a better control of injection sites and therefore administers the vaccine safely and effectively. It has been seen that the virus that causes COVID-19 can survive in the environment on surfaces from hours up to days. Therefore, high standards of environmental cleaning and disinfection are important control measures. It is recommended that cleaning should be undertaken at least twice a day, paying special attention to frequent high-touch surfaces such as door handles, tables, phones, and light switches. Let us now look at the immunization clinic flow in detail. It is proposed flow, however, you might need changing depending on your context. Let us look at the diagram from the perspective of someone coming in for COVID-19 vaccination. This person should first be screened for eligibility to ensure that the person falls in the group of those targeted for COVID-19 vaccination. If the person is eligible for vaccination, he or she should enter the clinic and go to the waiting area. It is important that people maintain proper physical distance at all times in the waiting area. Next, when called, the person should go to the registration area where specific forms can be completed. After this, the person goes to the medical screening where he or she should be screened for respiratory symptoms. If there are symptoms, the person should be immediately referred for treatment. Here, the person can also be checked for any contraindications for vaccination. After medical screening, the person should move to the vaccination area. Here, the health workers should provide COVID-19 vaccination using proper infection prevention and control measures as mentioned in the previous slides. After vaccination, the person should move to the post-vaccination area, where he or she should be observed for at least 15 to 30 minutes for an AEFI. After this, the person can then exit the vaccination site. Let us now look at the requirements for vaccination sessions in fixed posts. The main items include vaccine doses, which should be calculated based on target number, multiplied by adequate wastage factors. Next, the number of vaccine vials needs to be calculated, and this is done by dividing the vaccine doses needed with the number of doses per vial. It is important to have one auto-disabled syringe per vaccine dose. If the vaccine needs reconstitution, then diluents calculated as 1 per vaccine vial are needed, as well as reconstitution syringes, 1 per vaccine vial. Other items include safety boxes, tally sheets, list of contact phone numbers, and it is important to have an AEFI kit and an AEFI reporting form. These are specific for COVID-19 vaccines. Infection prevention and control kits are also very important, as well as a waste bin or a waste bag. Requirements for outreach or campaign vaccination sessions are similar to what's needed in fixed posts. You need to first calculate the number of doses needed after adjusting for wastage factor and accordingly calculate the AD syringes, diluents, reconstitution syringes, and safety boxes. Additionally, you need a microplan of the area. A vaccine carrier in good condition with coolant packs and foam pads is also necessary. Additionally, you need an infection prevention and control kit, tally sheets, list of contact numbers, remembering to take the AEFI kit and the relevant AEFI reporting forms for the COVID-19 vaccine to outreach and campaign settings. In addition to vaccination supplies, health workers are advised to carry IPC kits with them as a precaution. This kit contains PPE that may be required based on individual risk assessment. Eye protection, gowns, and gloves are not routinely required as they should be used only if dealing with suspected COVID-19 patients. Gowns and gloves should be discarded after single use. This kit should at minimum contain products for hand hygiene, which includes soap, clean water or Veronica buckets if sinks are not available, disposable or clean towels, or alcohol-based hand rub products, as well as medical masks, eye protection, gloves, gowns, a waste bin or garbage bag, Some other useful items to consider would be tissues, thermoscans for screening, cleaning equipment, visual reminders or signage, and physical barriers if spatial separations are needed. Here are the 7 steps to giving safe injections. It is important that anyone giving injections follows these steps. These are having a clean workspace, performing hand hygiene, using sterile, safety-engineered syringes, using sterile vials of vaccine and diluents, cleaning the skin, and appropriate collection of sharps waste and waste management. Most COVID-19 vaccine presentations will require intramuscular injection. To give the injection, hold the syringe and barrel with fingers and thumb on the sides of the barrel, and with the bevel of the needle facing upwards. Gently stretch and support the skin with the other hand and gently push the needle at 90-degree angle down through the skin into the muscle. Depress the plungers smoothly. Do not move the needle under the skin. Then, pull the needle out quickly and smoothly at the same angle as it went in. Discard the needle and syringe straight into the safety box. Waste disposal at health facility and in outreach campaign settings is essential. It is important to drop the used AD syringe needle end down into the safety box immediately after use. Never recap the needle to avoid needle stick injuries. Fill up to 3/4 of the safety box or up to the fill line. When the safety box is full, close it and keep it in a secure place until its final disposal. Dispose of empty vaccine vials and other waste in a separate container or a waste bag. Contaminated PPE is infectious waste and should be disposed of in a separate container or a waste bag as all other hazardous waste. Closing the vaccination site is an integral part of holding a vaccination session and should be done properly. When closing this session, discard in a separate waste bag or container any used, reconstituted COVID-19 vaccine vials. Count the unopened COVID-19 vaccine vials and diluents and write down the number on the tally sheet. If in outreach or campaign settings, return unopened COVID-19 vaccine vials and diluents, the vaccine carrier, and the coolant packs to the distribution point. Calculate on the tally sheet the number of COVID-19 vaccines administered, number of vials received, opened, discarded, and returned, and submit the tally sheet to your first-level supervisor. Here is a summary of the main points covered in this module. First, respect the standard infection prevention and control precautions for all vaccination sessions, regardless of the delivery strategy. Next, administer the intramuscular vaccine injection in the arm. And finally, safely dispose of sharps and other infectious waste. Here are some resources for additional and detailed information on some of the topics covered in this module. Thank you for your attention. Goodbye.